Did you know that nearly 30% of muscle mass can be lost by age 60, quietly affecting your strength, balance, and even heart health? What's surprising is how easily this decline goes unnoticed until everyday tasks become a struggle. It's a subtle change that many overlook, but it doesn't have to be this way. Here's the hopeful truth. A few simple changes in your daily habits, like adding the right vitamins and gentle movement, can dramatically strengthen your legs and boost your overall well-being. These small, manageable steps are easier than you think and can help you reclaim your independence and confidence. Muscle loss and leg weakness aren't just normal aging. So why do so many seniors miss this vital fact? The answer might surprise you. In this video, we'll reveal the 7 key vitamins that have helped countless people over 60 regain leg strength and prevent painful cramps and falls. Ready to learn how simple nutrition and lifestyle tweaks can make a big difference? Be sure to like, comment, and subscribe to Senior Health Over 60, and share this video with someone you care about. Your health journey starts now. Number 1. Common causes of leg weakness and falls in older adults. As we grow older, it's common to experience some changes in our bodies that can make simple activities feel more challenging than they used to. Many seniors notice their legs don't feel as strong, or they may have episodes of muscle cramps, stiffness, or even balance issues. But what's really behind these changes? Understanding the root causes is the first step to regaining strength and confidence. One major factor is the natural aging process. Over time, muscle mass naturally decreases, a condition known as sarcopenia. This loss of muscle means less power in your legs, making it harder to climb stairs, walk long distances, or even stand up from a chair without assistance. But age alone isn't the whole story. Often, nutrient deficiencies sneak in quietly and worsen these symptoms. For example, lack of vitamin D or magnesium can cause muscle weakness and cramps without obvious early warning signs. Seniors may attribute these aches and pains simply to getting old. But in fact, proper nutrition can make a big difference. Additionally, many older adults face complications from chronic health conditions and medications. High blood pressure, diabetes, or arthritis can impair circulation and nerve function, further weakening the legs. Certain medications, such as diuretics or acid reducers, may also reduce the absorption of key vitamins and minerals critical for muscle and bone health. Another important contributor is a sedentary lifestyle. After retirement or due to mobility issues, many seniors spend more time sitting and less time moving. This lack of physical activity accelerates muscle loss and joint stiffness, making the legs feel heavier and less responsive. Let me share a quick story. John, a 68-year-old retiree, thought his leg weakness was just part of getting old. He stopped walking regularly and found climbing stairs more difficult each month. After consulting his doctor and making small changes, adding vitamin D-rich foods and daily walks, John gradually regained his strength and can now enjoy his morning neighborhood strolls again. Recognizing these factors empowers you to take action. You don't have to accept leg weakness as inevitable. By addressing nutrition, managing health conditions, and staying active, you can keep your legs strong and maintain your independence. Number 2. The top 7 vitamins and minerals essential for strong legs after 60. Maintaining strong, steady legs as we age is about more than just exercise. It's also about giving your body the nutrients it needs to perform at its best. Let's explore the 7 key vitamins and minerals that play a crucial role in keeping your legs healthy, pain-free, and steady on their feet. 1. Vitamin D, the sunshine vitamin for strength and balance. Vitamin D is often called the sunshine vitamin because your skin produces it when exposed to sunlight. For seniors, vitamin D is vital not only for strong bones but also for muscle strength, balance, and coordination. Without enough vitamin D, muscles can become weak and cramp easily, increasing the risk of falls. Unfortunately, Older skin doesn't produce vitamin D as efficiently, and many seniors spend less time outdoors due to mobility or health concerns. That's why it's common for older adults to have low vitamin D levels. Studies show that adequate vitamin D can reduce fall risk by strengthening muscle fibers and improving nerve signals that help maintain balance. Getting 15 to 30 minutes of sunlight a day, ideally in the morning or late afternoon, helps boost your levels. You can also find vitamin D in fatty fish like salmon and mackerel, fortified milk, and egg yolks. For many, a daily supplement of 800 to 1,000 IU is recommended, but it's best to check your levels with a simple blood test first. 2. Calcium, building blocks for strong bones and muscles. Calcium isn't just about your bones, it's essential for muscle contractions too. Every step you take depends on calcium ions triggering your leg muscles to contract and relax smoothly. As we age, calcium absorption decreases, making bones more fragile and muscles more prone to cramps. This increases the risk of fractures, especially in weight-bearing bones like the hips and legs. Dairy products like milk, yogurt, and cheese remain excellent sources of calcium. But don't overlook plant-based options like kale, bok choy, tofu, almonds, and fortified plant milks. Aim for about 1,000 to 1,200 milligrams daily, combining food and supplements if necessary. Remember, calcium works best when combined with vitamin D and regular physical activity. Walking, resistance exercises, or even mild jogging encourages your bones to remodel and stay strong. 3. Vitamin B12, keeping your nerves and muscles talking. Vitamin B12 plays a critical role in the nervous system, ensuring that electrical signals travel smoothly from your brain down your spinal cord to your leg muscles. Without enough B12, this communication breaks down, leading to weakness, numbness, or tingling in the legs and poor coordination. Sadly, B12 deficiency is common in seniors due to reduced stomach acid, digestive issues, or certain medications. Those who follow plant-based diets are also at risk since B12 naturally occurs mainly in animal products like lean meats, eggs, dairy, and shellfish. Restoring healthy B12 levels through diet, fortified foods, or supplements can dramatically improve leg strength, endurance, and overall mobility. B12 supplements are safe because excess amounts are excreted in urine, but regular blood tests can help tailor your needs. 4. Magnesium, the muscle relaxer and energy booster. Magnesium is a powerhouse mineral that controls how muscles contract and relax. It helps reduce muscle cramps and stiffness, particularly the nighttime leg cramps many seniors experience, which disrupt sleep and cause discomfort. Beyond muscle health, magnesium supports bone density and regulates calcium transportation to bones instead of soft tissues, preventing joint pain and stiffness. Unfortunately, magnesium is often lost due to stress, certain medications like diuretics or proton pump inhibitors, and poor diet. Nuts, seeds, legumes, leafy greens, and whole grains are excellent sources. For those who struggle to get enough through food, supplements like magnesium citrate or glycinate are good options. Replenishing magnesium often leads to a quick turnaround in energy levels, reduced cramps, and improved leg comfort and mobility. 5. Potassium, the electrolyte for smooth movement. Potassium maintains fluid balance inside and outside your cells, enabling proper muscle function and nerve signaling. Low potassium can cause leg cramps, weakness, shakiness, and difficulty lifting your feet, factors that increase fall risk. Potassium also supports bone health by neutralizing acids that can leach calcium from bones. Foods rich in potassium include bananas, baked potatoes with skin, avocados, spinach, beans, and oranges. The recommended daily intake is about 3,400 milligrams for men and 2,600 milligrams for women. However, people with kidney issues or high blood pressure should consult their doctor before increasing potassium intake. 6. Vitamin K, the traffic controller for calcium. While calcium and vitamin D are well known for bone health, vitamin K is the unsung hero that directs calcium to where it belongs, your bones, instead of soft tissues and arteries. Vitamin K supports bone strength and density by activating proteins that bind calcium into the bone matrix. It also helps maintain healthy joints by reducing inflammation and stiffness, which is especially important for seniors dealing with osteoarthritis. Vitamin K1 is abundant in leafy greens like kale, spinach, and collard greens, while vitamin K2, found in fermented foods like natto and aged cheeses, has a longer-lasting effect on calcium regulation. People on blood thinners should talk to their doctors before increasing vitamin K intake to avoid interactions. 7. Vitamin B6, supporting nerve function and muscle recovery. Vitamin B6 helps nerves send clear signals to muscles, aids in muscle repair, and supports red blood cell production, which carries oxygen to your muscles for endurance. A deficiency can cause numbness, tingling, muscle weakness, fatigue, and slow recovery after physical activity, symptoms often mistaken for normal aging. Good sources of B6 include chicken, fish such as salmon and tuna, bananas, potatoes, chickpeas, and fortified cereals. Older adults typically need around 1.5 to 1.7 milligrams daily. While B6 supplements can help those with absorption issues, excessive high doses may cause nerve damage, so it's important to follow recommended amounts. These 7 vitamins and minerals form the foundation for healthy legs that carry you confidently through your golden years. They work together in harmony to build strength, improve coordination, and reduce pain and cramps. Remember, before starting any new supplement regimen, it's best to consult with your healthcare provider and consider getting simple blood tests to identify specific deficiencies. Number 3. How to recognize deficiencies and properly supplement these vital nutrients. Understanding the importance of vitamins and minerals is one thing, but knowing when your body actually needs them is another. Many seniors don't realize they are deficient until symptoms become pronounced. The good news: with a little awareness and some simple steps, you can identify and address these gaps early, keeping your legs strong and your mobility intact. First, pay attention to subtle signs that might signal deficiencies. Persistent muscle cramps, especially at night, unexplained fatigue, numbness or tingling in your legs or feet, and feelings of weakness can all be red flags. Sometimes you might notice difficulty rising from a chair or climbing stairs that once felt easy. Diet is your first line of defense. Eating a balanced variety of foods rich in the nutrients we discussed, like leafy greens, dairy, fish, nuts, and legumes, can go a long way. However, aging bodies often don't absorb nutrients as efficiently, and medications common among older adults can interfere with this process. That's why blood tests are invaluable tools. Simple tests can measure your vitamin D, B12, calcium, magnesium, and potassium levels. These tests help your healthcare provider recommend personalized strategies to restore balance safely and effectively. If you're considering supplements, here are some tips. Always consult your doctor before starting. Supplements can interact with medications or existing conditions. For instance, too much calcium or vitamin K can affect blood clotting or kidney function if not monitored properly. Also, supplements aren't magic pills. They work best combined with a healthy diet and regular physical activity. Walking, stretching, or resistance exercises improve your body's ability to use these nutrients effectively. In summary, recognizing deficiency signs early, maintaining a nutrient-rich diet, getting tested, and consulting with your healthcare provider will help you choose the right supplements and dosages. This proactive approach protects your legs, strength, and supports your independence. Number 4. Lifestyle habits that boost nutrient effectiveness and support leg health. While vitamins and minerals are essential, they work best when combined with healthy lifestyle habits. Simple daily actions can significantly enhance your body's ability to absorb nutrients and keep your legs strong and flexible. First and foremost, regular physical activity is key. Activities like walking, gentle yoga, gardening, or even light resistance training help maintain muscle mass, strengthen bones, and improve balance. Weight-bearing exercises signal your body to remodel bone tissue, making calcium and vitamin D more effective. Next, getting moderate sunlight exposure is a natural way to boost vitamin D production. Aim for 15 to 30 minutes in the morning or late afternoon, with arms and legs exposed. Just remember to balance sun exposure with skin protection to reduce the risk of sun damage. Another important factor is quality sleep. Good sleep supports muscle recovery, reduces inflammation, and helps regulate hormones involved in bone health. If leg cramps or discomfort interrupt your rest, addressing magnesium levels and nighttime hydration can help. Finally, managing stress and maintaining a positive mindset play subtle but powerful roles. Chronic stress can interfere with digestion and nutrient absorption, while a hopeful attitude encourages consistent healthy habits. By pairing proper nutrition with these daily practices, you empower your body to stay resilient, keeping your legs strong and your movements steady well into your golden years. To wrap up, keeping your legs strong and steady as you age isn't just about luck, it's about smart choices. By ensuring you get enough of the right vitamins and minerals, combined with regular movement, balanced sun exposure, and good sleep, you're investing in your independence and quality of life. Remember, leg strength supports more than just walking. It affects your confidence, your ability to enjoy activities you love, and your overall well-being. Don't settle for weakness or discomfort as just part of getting older.